So, good evening, everyone. And quickly, we'll move on to the testosterone therapy in diabetes. Yes, it is a double-edged sword. We'll discuss quickly the benefits, risk, and clinical considerations, whether we should consider the testosterone therapy or we should be uh, aware of. So, testosterone plays a crucial role in male's health. Testosterone is not always about sex. It includes metabolism, it improves metabolism, muscle mass, and fat distribution. And of course, hypogonadism, that is low testosterone, is common in men with type 2. But there is another phenomena that a low testosterone level also predisposes a patient to a higher risk of getting type 2 diabetes. And we'll explore the potential benefits and risk of testosterone therapy for men with type 2 diabetes. Yes, there is a bidirectional interaction between androgens and diabetes in men, in which low testosterone predisposes to diabetes and hyperglycemia leads to hypogonadism. That is, even a patient who is hypogonad predisposes a patient to development of type 2 diabetes. And there is substantial evidence that low testosterone is associated with and predicts diabetes in men. And there's one more thing: with the increase in human longevity, men in the future will spend a significant proportion of their lives in the state of testosterone deficiency. And that also would predispose a patient to a higher risk of getting type 2 diabetes. So, low testosterone levels, yes, there is a link between testosterone and diabetes. Low testosterone is linked to increased insulin resistance and obesity, leads to higher visceral fat, higher inflammation, and higher metabolic imbalance. Certain studies indicate that men with diabetes are twice as likely to have low testosterone, and testosterone therapy may enhance insulin sensitivity and reduce HbA1c levels. But there's one more aspect. If you are navigating the stormy seas of declining energy, diminished muscle strength, or a flagging sex drive, even in diabetes, then testosterone replacement therapy might appear as a beacon of hope on the horizon. But it comes with its own sets of pros and cons that requires thoughtful considerations. And let's break down with what you need to know. So, potential benefits of testosterone: certainly, it improves insulin sensitivity and glycemic control. Some studies have showed improved glucose metabolism, can help reduce dependence on diabetes medications. But mind it, only a patient with pre-diabetes would be helped when you consider a testosterone replacement therapy. It certainly reduces body fat, increases muscle mass, can enhance physical performance and energy levels, and reduces chronic inflammation, could lower the risk factors associated with diabetes. And yes, it helps in reducing oxidative stress, may reverse type 2 diabetes, but again, you can individualize. A patient in a pre-diabetes state could be benefited with testosterone replacement therapy, of course, if he is hypogonad. So pros: enhanced glucose metabolism. Certainly, some studies show that testosterone replacement therapy lowers HbA1c level, but that the mean decrease in HbA1c is very brief, 0.1 to 0.2%. May reduce the need for diabetes medication in some patients. Reduction in body fat is seen with testosterone replacement therapy, helps reduce visceral fat, which is linked to insulin resistance, and promotes lean muscle growth, improving metabolism. On an aspect, also it lowers chronic inflammation. Yes, we know the pathophysiological base in diabetes is associated with chronic inflammation, which contributes to complications, be it macro or microvascular. And testosterone therapy may reduce inflammatory markers like CRPs and interleukin 6. Less inflammation can lead to improved cardiovascular and metabolic health. In terms of reversing type 2 diabetes, there are certain studies, but they are very controversial. But some research suggests that long-term testosterone therapy may reverse diabetes in some men. But again, I would repeat, a patient in a pre-diabetes stage would be benefited most as compared to a patient having HbA1c of 9 to 10%. And a study has found that men on testosterone replacement therapy achieve diabetes remission with proper management. But that too, these studies are very controversial. We can't exactly say that whether this could be possible or not. Then we'll come to cognitive functions. Testosterone is linked to depression and brain fog, patient with irritable bowel syndrome, patient with type 2 diabetes, and of course patient with high level of anxiety does faces a lower testosterone levels and then have symptoms of hypogonadism. And testosterone therapy can improve mood, memory, and cognitive function, and helps with mental clarity and emotional well-being. Certainly, it increases libido and sexual function, improves erectile function, boosts sex drive. Again, That would only be possible when a patient is a hypogonad. If you have a normal testosterone levels and then you want to improve the libido and sexual function, then basically you would get a benefit with testosterone therapy, and can help with sexual dysfunction, which is common in diabetic men. Enhances overall quality of life and confidence. Now coming quickly to the cons, yes, there are certain conflicting studies also. Some studies show positive effects while others do not. Results vary based on patients' demographics and baseline testosterone levels. Again, I would say customizing the patient's profile would be beneficial when you are considering testosterone replacement therapy. And there are some dark sides also for testosterone replacement therapy. They can exacerbate underlying metabolic conditions if not properly monitored. Increase the risk of cardiovascular issues, prostate problems, and erythrocytosis. Can cause hormonal imbalance if not certainly or carefully managed. Some studies show that testosterone improves insulin sensitivity, but of course, few studies have also shown or indicated that it may worsen insulin resistance by decreasing. See, there are many pathophysiological phenomena, but most commonly we have seen is that testosterone therapy does decrease adiponectin levels, increases pro-inflammatory cytokines, and of course reduces hepatic insulin clearance and increasing gluconeogenesis. That is the way indirectly it actually would increase the insulin resistance rather than improving the insulin sensitivity. It also possesses or predisposes the patient to a higher cardiovascular risk. Also, testosterone therapy can raise red blood cell count, we know as polycythemia, and this actually increases the risk of blood clots, heart attacks, and strokes. So a patient with a previous history of ischemic heart disease or CVA, the testosterone therapy should be considered very grimly. And people with diabetes already have a higher risk of heart disease, making this a serious concern. If we talk about the prostate, yes, testosterone therapy has a potential to worsen prostate health, also increased risk of BPH leading to urinary symptoms, and possible link to prostate cancer in some individuals has been seen with testosterone replacement therapy. One more important aspect, fluid retention is seen with testosterone replacement therapy, and blood pressure issues also. Testosterone therapy can cause fluid retention. How? Most commonly by enhancing the activity of RAS, leading to increased aldosterone secretion, and thereby causes increased ADH secretion and promoting water retention, and thereby the risk of fluid retention or edema is very high with the chronic testosterone replacement therapy. Then again, sleep apnea. Yes, sleep apnea, testosterone therapy can worsen sleep apnea, a common but often undiagnosed condition in men with diabetes. Worsening of obstructive sleep apnea will increase oxidative stress, certainly reducing GLUT4 receptors, very important. It actually reduces the GLUT4 receptor, causing poor glucose uptake by the muscles, and worsening OSA will increase the visceral fat deposition, thereby predisposing a patient to higher oxidative stress and leading to macro as well as microvascular complications. This is a very I don't seem that anyone can understand, but so considerations. The effects of testosterone therapy may vary based on individual health conditions. Testosterone replacement therapy should not be the first line treatment for diabetes, of course. Lifestyle interventions remain critical in managing diabetes, and further studies are needed to determine the long-term impact of therapy. Patients should undergo routine monitoring to assess hormone levels and metabolic responses, and individualized treatment plans should be prioritized over generalized recommendations. What are the clinical recommendations? General common clinical recommendations. Testosterone therapy should be considered only for men with clear hypogonadism and symptoms. A patient has low testosterone levels but no symptoms of hypogonadism, then also testosterone replacement therapy should not be considered. And regular monitoring of glucose metabolism, cardiovascular health, and prostate health is of course essential. Physicians should assess benefits versus risk on a case-based, case-by-case studies, and more of course more research is needed before widespread use in diabetic patients. Alternative therapy should be explored when necessary. So to conclude, testosterone therapy has potential benefits but also significant risk in men with type 2 diabetes. The relationship between testosterone and diabetes is complex and not fully understood. Until more evidence is available, testosterone therapy should be used cautiously and only in those with clinically diagnosed low testosterone. Lifestyle modifications remain the cornerstone, and individualized patient care and ongoing monitoring are essential in achieving optimal health outcomes. Thank you.